This is a case of a 74-year-old male patient who had a cardiac arrest and initially underwent a CT scan of the head. No acute brain injury, particularly there is no evidence of uh, brain edema or hypoxic brain injury according to the CT criteria. Now I will show you the CT scan of the head the next day after 24 hours. Clinically, the patient developed bilateral dilated fixed pupils, low GCS, and here is the second CT scan of the head. Let's discuss the findings. First of all, we can see that there is significant brain edema, effacement of the peripheral CSF spaces, effacement of the sulci, effacement of the basal cisterns, and significant crowding of the foramen magnum. This means brain herniation through the foramen magnum, low position of the cerebellar tonsils. Another interesting finding is that there is new hypoattenuation of the deep gray white matter, the basal ganglia. And there are scattered areas of low attenuation as well throughout the brain, here and here. There is also evidence of the so-called pseudo-subarachnoid hemorrhage. First of all, the effacement of the peripheral CSF spaces, the significant effacement of the sulci and the basal cisterns are due to the cytotoxic edema. There is also loss of gray-white matter differentiation. It is worth to mention that the predominance of gray matter injury is due to its high metabolic requirement for oxygen and glucose. That's why the injuries appear first in the gray matter. These are typical hypoxic injuries. Due to cerebral edema, there is decrease of the parenchymal attenuation and swelling. The swelling and engorgement and dilatation of the superficial venous structures due to an increased intracranial pressure results in the appearance of the subarachnoid space to falsely appear slightly hyperattenuating, and there is a false feeling that it is filled with blood and appears slightly hyperdense, and this is the pseudo-subarachnoid hemorrhage. We can see some linear and patchy hyperdensities. There is also narrowing of the main intracranial vessels and arteries due to edema. They are compressed. The fourth ventricle is almost collapsed, and there is significant edema of the brainstem. And now let's compare the images. This is the current CT scan And this is the yesterday CT scan of the head, and we can see the obvious differences: brain edema and the hypoxic brain injury. Dear friends, thank you for watching this interesting video. See you next time.